Good morning. It's Thursday, November 19th. Welcome to The Doctor is In, Ask Dr. Arwady. This is where you can get your questions answered, everything to do with COVID-19 in Chicago. I'm Sybil Madison, your Deputy Mayor for Education and Human Services, here with Dr. Allison Arwady.
Good morning.
Your Commissioner for the Chicago Department of Public Health. We want to hear from you, so you can submit your questions using the chat box below, or you can send your questions through Facebook or Twitter using the hashtag AskDrArwady. As we always do, we're going to check our distance, which is looking good, and I'm just going to turn it right over to you to give us an update.
All right, sounds good. So thanks everybody for joining, and thank you everyone who is doing the right thing now in Chicago, which means you are staying home except for work, school, and essential activities like medical care or getting groceries. You are definitely not attending any gathering as much as possible, and any gathering, even like a wedding or a funeral, cannot be more than 10 people right now.
That's right.
If it can be delayed, it needs to be put off. That you are not having people over into your home. And that just over and over again is where we continue to see trouble. It's where people let their guard down. So right now, unless it's like a home health aide or someone coming in, essential childcare, essential education, please do not have folks over. You shouldn't be traveling right now. The whole country is in trouble from a COVID perspective. And then of course, leading up to Thanksgiving next week, if you've not already had those really difficult conversations with your friends and family, this is not the year for a traditional Thanksgiving. So hopefully you are doing all of that, along with the wearing the mask, social distancing, hand washing, staying home when you're sick, which has been some of our most important guidance all along.
Staying home when you have symptoms.
Staying home when you have symptoms.
There are those of us who are like, oh yeah, I'm fighting it, or I'm not sick yet, but just those symptoms alone,
Yes,
right?
Exactly. Even, where we do our case investigation, something like half of the people who are working tell us that they were working for at least a few days after their symptom onset. And those are usually people who, if they had really thought they had COVID, of course would have stayed home, but nobody ever thinks it's COVID. So any symptoms, stay home, especially right now. We shared on the press conference on Tuesday that really our estimates show that as many as 1 in 15 Chicagoans could have COVID right now. And that's based on how many people are infectious right now, based on the underestimation that we know where a lot of people are not getting tested. So now is the time for caution.
And is there a connection between that 1 in 15 and gathering sizes?
Yes, exactly. So this is where where we talk about being in a gathering of even 10 people. And I've seen there's some nice maps out there on the internet right now that are looking at the risk across the country of, say, a 10-person gathering for Thanksgiving and how likely it is that somebody at that gathering will have COVID. And unfortunately, those numbers are high right now in Chicago and continue to rise, because if 1 in 15 people potentially are infectious with COVID, then, and it's somewhere between 1 in 15 and 1 in 20, like this is for real, not just a guess, that if you're having that many people over, someone statistically would be expected to have COVID.
Yeah, and I heard our very own Dr. Friccione talking about, in a gathering for Friendsgiving or Thanksgiving, you're eating and drinking.
Yes.
And you won't be having a mask on while you're eating and drinking.
Yeah.
And so we might think that it's, innocent and just fine, but it is a risky situation.
Exactly, and you've got the masks off in that setting, and often people are sort of gathered together and not distanced, and then unfortunately, where you add on to that travel around the country, people who are not usually together, unfortunately, it is a setup for trouble. And even Canada, that has generally had better success with controlling COVID, did see some surging after their Canadian Thanksgiving back in October, and unfortunately, I think ours could be quite a bit worse. So we don't want that trouble here in Chicago. Let's look at our data. CHI.gov/COVID- as always, or Chicago.gov/coronavirus, and up at the top, go to latest data. If we look at the dashboard here, first of all, on the top, you'll see our current positivity rate is at 15.5% across the city. Last week, we were at 14.2%. Remember, our goal is to be back down under 5%, which is where we were at the beginning of October. If you have been following this daily, you might have noted that 2 days ago we were at 16%. So we may be beginning to see just a little bit of some flattening there. It is way too early to call it, and 15.5 is not a number to brag about or feel comfortable with. But we are continuing to grow testing. You can see our daily testing average is at 16,500 per day, the highest it's ever been. We go back to just early October, we were doing about 8,000 to 9,000 tests a day. So we've approximately doubled our testing capacity. And we had a press conference yesterday, if you're interested, where we talked a lot about the details of stay-at-home tests, ones that you can order from home that now are available and FDA approved, including some that are covered by insurance, so you don't even need to pay up front. We talked about some of the work that we're doing to expand testing through our federally qualified health centers and our other providers that are doing a lot of community testing. And we talked about some of the expansion that the Chicago Department of Public Health, through the community testing that we fund, is also doing. Our daily running case average is at almost 2,400 cases per day. That's up 29% just from a week ago. Again, we need to see some flattening there, and the next few days to weeks are going to show us where we're heading here. If you look at the hospital numbers, you do see those continue to rise. We expect that in the context of numbers like this from a case perspective. Yeah. Many people who get COVID, the great majority, luckily, do not get sick enough to need to be in the hospital. But when we're talking about numbers like this and the fact that we've been seeing real increases in all age groups, including those in their 60s, 70s, and 80s, this is not sparing people with underlying conditions. We are seeing more people in the hospital, in the ICU, on ventilators every day. And even our deaths are averaging 8 deaths a day right now. And 8 deaths a day, you think, oh, 8, that isn't that many, right? That's 56 a week. And over the summer, we were 2 to 3 deaths a day. That's 14 to 21 a week. And that's just from COVID. And unfortunately, the state has been breaking records for deaths and records for hospitalizations. Here in Chicago, we have not yet broken our May records for hospitalization or for deaths. And we don't want to.
Exactly.
So the goal really is doing all the things that we know work, help us bend this curve. We know how to do it, and I think, the time is now for action. So I think that's probably good for data for today. People could continue to explore as they like.
Yeah, and just we know that hospitalization and deaths lags cases, right?
That's
so
right.
Even if there's a little bit of a corner of sunshine that we're seeing, we still have, right? It takes us a while to really bend it down.
Typically, you see the surging of cases that get hospitalized be sort of about 11, 12 days after kind of where you're seeing the surges of cases. And then it's another week or so after that where you see the ICU and the death. And that is just the clinical course of COVID. So we'll see. I'm very hopeful that perhaps we're just starting to see the earliest signs of some of the mitigation things that have been put in place, but it is way too early to call that. And where we are looking at, especially heading into Thanksgiving next week, this is an extremely risky time for the U.S. And for Chicago. So we'll keep a close eye on that, and we'll keep everybody posted.
Okay, let's get into your questions. Alicia Ernestine Carter from Facebook. Can COVID symptoms be similar to the rhinovirus? How can you tell the difference?
Okay.
The rhinovirus.
The rhinovirus. You may not know what the rhinovirus is.
I actually do not know what the rhinovirus is.
So the rhinovirus is another virus. We encounter, so many different viruses through our life. It's one of the ones that causes the common cold.
Okay.
But when you do a swab, like in an emergency department setting or a hospital setting, it's one of the viruses that we'll test for. There is no way to know whether your symptoms are from the common cold, from rhinovirus, from influenza, from any of the other many viruses in the world, at least the ones that are respiratory viruses. There's no way to know whether that is rhinovirus or COVID. So the bottom line is, if you are having symptoms of a virus, of a respiratory virus, you need to assume that it is COVID until proven otherwise. You need to stay home, get a test, treat it like COVID. With so much of this going around right now, there's a good chance it is COVID.
So don't spend time trying to self-diagnose.
Yeah.
assume that you have COVID and act as if you do.
Assume that you have COVID, act as if you do, stay home. You can go out to get a test masked up. You can order a test to your house, and there is a link on chicago.gov/coronavirus around testing about how to do some of that. But the bottom line is you can't diagnose this. And we talked on Tuesday a little bit. Somebody had a question about that with flu. There is also no way to know for sure. If you happen to have the loss of smell and taste that many people do have with COVID, that's pretty diagnostic of COVID. We don't see that with other viruses. But there are lots of people who have COVID who never have a loss of taste and smell. Bottom line is assume it's COVID, and you need a test to know for sure.
Got it, doctor. Anna Dickey from Facebook, how do we prevent people with diabetes and people who are cancer survivors from getting COVID?
Okay, so the exact same way we prevent everybody else from getting COVID. But I do think people who have diabetes or other underlying conditions, we know, of course, those folks are the people most likely to get really sick, to get hospitalized, unfortunately, even to die. We've seen that very strongly here in our Chicago data, in data from across the country and the world. So what I would say is that folks with these underlying conditions themselves, I hope, are being extra careful at this time, but also think about who is in your bubble. If you have someone who lives in your household with one of these underlying conditions, if you are out and about, you run the risk of bringing that back. If you are getting together with people, which hopefully you are not, from outside your household, recognizing that, the bubble that people think they have is not always the actual bubble, because each of those people are then in touch with others. So I think there's nothing different about protecting folks with these underlying conditions. It's just being extra careful and really limiting risks, not just for them, but for anyone who is in close contact for someone with an underlying condition.
Okay. Jacqueline Laura Mello from Facebook. The devil works hard, but the dream team, Allison Arwady and Ngozi Ezike, work harder. Congrats on being named Chicagoans of the Year.
Oh, thanks. Appreciate it. I don't care about Chicagoan of the Year. I care about these numbers going down. I mean, not that I don't care. I appreciate, the honor. And obviously, Dr. Ezike and I work very hard, as do so many other public health professionals across the city, across the state, in our 97 local health departments. We have all been working on overtime, and even more so right now in this second surge. And so I know everybody's tired of COVID. We're a little tired of COVID, although I do still remain very, interested in it and very glad that I am working on this. I know we can do this, and my hope is that, where there's recognitions like that, they're actually serving to remind people that this is not in the past. This is not like we're done with COVID, yay, we've gotten through, but that there are a lot of people working really, really hard to not have this winter be as hard from a COVID perspective as it has the potential to be. So Thank you for that.
Well-deserved honor. Morgan Bryan from Facebook, is aerobic exercise a no-no if you are an asymptomatic positive COVID?
Okay, so if you have COVID and you are not having symptoms, the most important thing, of course, is that you need to isolate, meaning you need to be home. You need to not be exposing others. You need to be very, very careful about others who may be in your home. There's nothing that says you can't exercise if you're really feeling perfectly fine. My thought is taking it a little easy if you right now have a COVID diagnosis is probably the way to go. And increasingly, there are people who are, there's just a lot more people with COVID right now. And I think recognizing that if you have COVID, please, take it easy. That is a time for resting, for drinking a lot of fluids, for eating your fruits and vegetables. You can take your vitamin. You can do some gentle exercise. You can
Can you go out for a run? Would you recommend that?
If you are sick with COVID right now, if you are right now within 10 days of having a COVID test, just stay home, please. Even, if you can go out in your backyard or something by yourself where you're not going to be in contact with anybody else, okay. But please don't even run the risk of going out and potentially running into somebody. You can do some exercise in your home. That is just fine. You can go in your back area or your private area, or if you are, out maybe on your porch where there is nobody else around. But like for that 10-day period, the most important thing is that you don't spread COVID.
Yeah. Okay. We have a lot of questions rolling in. Kathy Burke from Facebook, with this vaccine coming out, are those of us with COVID allowed to get the vaccine when it's available?
Yes, definitely. So, of course, we don't yet have a vaccine that has been approved, that has gotten that emergency use authorization. And what will happen, the FDA is looking at the first application for that, the Pfizer vaccine, right now. It was just submitted yesterday. Really exciting. And that preliminary data that we've seen in the media looks really good. The efficacy was more than 90%. The safety profile was very good. But that data is getting looked at in extreme detail right now by the FDA, by the external group of scientists and researchers. And then if it gets that emergency use approval, the CDC and the group is called ACIP that makes the actual recommendations for vaccine will be making those recommendations. But absolutely, the expectation right now is that everybody, broadly at some point will be recommended to get this vaccine. We will not assume that because you've had COVID, you've had immunity, or that you somehow are not eligible. We will be much more trusting of protection that comes from a vaccine where it has been standardized, tested. There's not this, somebody who is more seriously ill from COVID mounts a much stronger immune response than someone who's had a less of a serious infection. Probably their immune response is less. So absolutely. Right now, again, anything could change, but right now, my extremely strong expectation is that this vaccine will be available and will be recommended for people, regardless of whether you have had COVID in the past, regardless of whether you have had antibodies. And in fact, the parts of the city that have been hit hardest from COVID, where we may have seen the most people get infected, to me, we had a question, not on Facebook, but somebody asked this at work this morning. Would we think about not prioritizing those areas because perhaps more of those people have had COVID, right? And there's more levels of immunity, there's maybe more protection there. Shouldn't you start where there's been less COVID? But to me, the areas where we've seen a lot of COVID are the places where we have a lot of essential workers, people who are out and about, perhaps people who are living in more crowded housing or have less ability to isolate. Those same people who are the ones who are out and sort of keeping our society moving are the ones you most want to vaccinate because you want to limit that potential spread of COVID. And although we'll still be learning, right now, again, with this new COVID vaccine, even if we know that it is protective for you, we're still learning, and we will be learning to know for sure, does that vaccine also protect me from spreading to others, right? There are a lot of unknowns still, which is why even when the vaccine is coming out, for months and months, we are going to continue to be wearing masks, social distancing, regardless of this vaccine rollout. And I know that's going to be complicated. There will be much more information coming, much more to talk about. But at the most basic level, I do anticipate that this vaccine will be recommended very broadly. We will not be looking to see, did you have COVID before? And for me, where I think about who we most want to be getting this vaccine, it's going to be a lot of the neighborhoods and the groups that have been hit hardest by COVID. That is where I most want to see protection. We're starting with healthcare workers from a prioritization perspective, and healthcare workers in the hospital, because they are the ones who every single day are exposed to COVID. They are taking care of people in the ICU, on the hospital floors, in the emergency department with COVID. They're the ones doing the procedures. They're putting tubes down people's throats. The respiratory therapists are, giving the breathing treatments. These are our folks at highest risk in the entire society for getting COVID, and it's really important that we protect them from a, societal perspective. So that's where we start, and then there will be some additional work where we think about long-term care facilities and who's been really sick there. So we talked on Tuesday a little bit about prioritization. There will be some more of that. But the bottom line is that I'm so excited about this vaccine. We've got to wait to make sure truly the safety and efficacy and everything is there. And there won't be a recommendation until that absolutely is solid, and we are confident that it is the time to recommend it. But even once we recommend it, it'll start very small here, because that'll just be the amount of vaccine that we get, and then we'll be moving out from there. And it's not going to be spring, most likely, until most of you are going to be able to get vaccine.
That's what I was going to ask. Like, the average person who doesn't work in a hospital,
right,
is not, just a regular person, right?
person,
like,
yes.
We're so excited about the vaccine.
We are.
How long might we have to wait if we're not in those categories?
That's right. And I can't fully answer that right now, but if you think about needing to manufacture a vaccine for literally the whole country or the whole world, this is just on a scale that we have never done, not in this amount of time. And so one of the reasons there are so many vaccines under investigation is that each of these vaccines is likely, we'll see which ones are shown to be effective and shown to be safe. There may down the line be some that show they're especially good for people who are older, or they're especially good for people, right? Like, we'll be learning. It's actually an opportunity.
It's going to continue.
It's going to continue. And it's also an interesting opportunity. There are different technologies that have been used to make this vaccine, and it's going to be an interesting opportunity that may even affect vaccine manufacturing long term, to have some almost head-to-head comparison of different technologies of vaccine. But we really are going to need a lot of different vaccine candidates to have the manufacturing capacity to be able to get this out more. And these have different, most of them are 2-dose vaccines. There's only one right now that's in a phase 3 trial in the US, and it's further back that would be a 1-dose vaccine. They have different requirements around shipping, how cold it needs to be. Like, there's lots of pieces in this, but it is going to take time to manufacture and get this distributed, and it's going fast. That part, remember, we've started production of these vaccines even while the trials have been going on, with the hope that they would prove to be effective and safe. And so it'll go as fast as it can, but I'm really anticipating it'll be more like March, April, May before we're maybe seeing really large amounts of vaccine here for the public. Kids, I don't anticipate until the summer at the earliest, just where we think about those trials need to be done, and kids are less likely to have the severe outcomes, so they'll be lower priority. So more to come on that, but it's very exciting news. The virus does not know that this vaccine is coming, though, so it continues to behave just like it's always behaved, and we are going to have to keep up these mitigation strategies. But I hope this, hope of the vaccine, it tells us that, we're not doing this forever.
Yeah.
We got to do this for some longer, but we're not doing it forever. We can beat this thing.
Yeah. A little bit of light.
A little bit of light.
At the end of the tunnel. Aaron Hoffman from Facebook. I've never had symptoms, but just wondering if I should get tested for COVID anyhow.
If you've never had symptoms and you're not having high-risk exposures, there is no reason for you to get tested for COVID right now. I think, that's always a little bit hard for me to answer in the abstract, because I don't know you and where you, what your exposures are like and where you live. But I don't necessarily, if I'm not going and regularly getting tested if I'm not having exposures or other concerns. And we don't need, particularly during a time of surge like this, if you are at home and you're being very careful and you're feeling well, I actually would not want you to sort of build, where we're working to build testing capacity and make sure everybody who has symptoms, who has exposures, who's living in our high-risk areas, et cetera, we really want to make sure they are all able to get tested. So no, there's no reason for you to get tested unless certainly if you have symptoms, you need to get tested. If you've not had symptoms, but you've had a significant exposure, that would be a reason to potentially get tested in the right time frame. And then we're doing some pushing in some of our highest risk neighborhoods and areas where we're just seeing very high positivity. But for the general Chicagoan who's feeling well and being very careful about COVID, you do not need to routinely be getting tested at this time.
Got it. Lori Beth from Facebook. What kind of research is being done about hotel guest safety now that we know that aerosols can easily travel through heating vents?
Okay, so let's take that just a little bit.
Couple of layers there.
So on this sort of airborne piece, I don't want people thinking that this means that, what was the term? That
Aerosols?
Yeah, no, but that they can easily spread through heating vents.
Yeah. So the HVAC systems.
Yeah, we do not think that COVID is easily spreading through heating systems. And I want to be clear about that, because I think, one of the hardest things for people to do is understand what is the high risk, what is the medium risk, where do I worry, how do I minimize my risk? And it is true and has been true from the beginning that exposure to living, breathing human beings is your highest risk factor by far, by far, by far. And that risk factor goes up if you are within 6 feet, and it goes up doubly if you are without a mask. Those are like the two most important things. We have certainly learned that, especially in enclosed spaces that have, very poor ventilation, especially if people are not wearing masks and they're shouting or singing or exercising, that has been shown to also carry some risk with it. And this whole conversation about airborne, yes, we have seen that it is possible for the coronavirus to be suspended in the air, but it is still not behaving like measles, for example. Mm-hmm. Measles is a really, really infectious airborne virus that we know that if someone is even in the room with someone who has measles, or even if they're in the room 2 hours after someone was in there who has measles and they're not vaccinated, chances are very good they're going to get measles. COVID just doesn't behave like that, mm-hmm. okay? And so I live in a, in a building that has 6 units in it. I don't worry at all about, do my neighbors have COVID? Do I need to do something different? Like, the risk is really so much greater when you're having this close interaction. To the point of hotels, though, hotels are examples of buildings that are large and do have large HVAC systems. And so there's been a lot of work in larger buildings, larger apartment buildings, office buildings, to take a close look at that HVAC system in the context of COVID, to make sure that they are up to code, to make sure that we've increased the amount of airflow that is sort of coming through here. There are standards around that. And typically, you might only run your HVAC system, 25% of the time or so. You might only run it when you're running the heat or running the air conditioning. Mm-hmm. But during COVID, we're running it more. We want more air exchange. We want good filters in there. This is where some of this MERV filter comes in, which we could talk about at some point if people are interested. In terms of, though, like in your house, if you want to add sort of this additional ventilation piece, which is a question we also get. I know we've been getting questions, so we'll just expand on it for there. Again, most of the risk is when people are in your space, okay? So far and above not having people coming into that space, especially without social distancing, especially without a mask, that's 100 times more important than anything you're going to do with air filters and stuff. If people do want, and I know people are buying in some mm-hmm. cases, HEPA filters or sort of these mobile filters, good. You can buy those. Those can help. Those do not, though, take the place of a mask or of, mm-hmm. not having people over. But for example, if you're, we've had people ask if someone is going to be isolating at home and maybe they have COVID, can I buy a filter or something? Yeah, you can. These HEPA air filters, they're about $200. They're standalone. And they do filter out broadly COVID, because COVID they still live in respiratory molecules. But you would just want to look at what is the size of my space, but it's an added piece. It is not the most important piece. Even where we think about schools, the CDC recommendations for schools are around masking and cohorting and cleaning and case investigation.
The top 5
mitigation strategies don't even have ventilation in there, and that's based on data. We've seen Chicago Public Schools and others invest heavily to make sure that their classrooms are well ventilated and have these same HEPA filters and have the HVAC systems going depending what it is. But that is additive, and it is not the most important piece. So You know, someone was asking me actually if we got someone with an underlying condition and I want to do something more. Yes, if you want to buy one of those, you can. It's additive. Opening a window a little bit also does beautifully for you. I open a window a little bit if I'm riding in a car, like if I occasionally have to be in an Uber or something and I don't exactly know. You open that window a few inches, you've got good airflow. That's some additional protection. But don't let that take the place of the masking and the social distancing and then just not being in close touch with humans. That remains much, much more important still. And don't buy into all of these like UV and ozone, and there's a lot of craziness out there. People are taking advantage of this and trying to sell stuff. Things that try to, ozone can be an irritant for the lungs. UV, most of what they're selling on the market is like not really doing much of anything, but true UV disinfection needs to be done by professionals. Basic, if you're going to do something, a basic air filter is fine and can add and can help, but I did not buy one. I do not think that this is something that is necessary for most people, but it could be an added piece if you have concerns about ventilation.
Okay. I think you answered Dee Sanders' question, which was, what is your opinion on air purifiers?
Oh, well, there you go.
So that one, check.
Additive.
Here's a great question from Francisco Armenia from Facebook. What's the point to get the vaccine if we are still going to have to wear the mask?
Okay. So the point of getting the vaccine is that this is how I think we are going to get out of COVID. Because if you have a good vaccine that is more than 90% effective, the idea is this will actually stop the spread of COVID. The masking is not forever, okay? The masking is for the time period where we are rolling out this vaccine and getting to so-called herd immunity safely through the vaccine. That is going to take months, and during that time period, we're going to need people to continue to wear the masks and do the distancing because there's going to be a mix of people who have vaccine and don't. And remember, we're still learning to make sure that the vaccine is also protective against the spread of COVID. We think it will be, but I just want to be clear, that's one of the things we're still learning. So I really see with vaccines that at least the preliminary data looks this good on. That says we actually, it's like measles. Our measles vaccine is like 97% effective if you take 2 doses of it. We've got widespread vaccination of that as children. We don't worry about big measles outbreaks as long as that vaccination level stays up. The hope is we can actually have this be like COVID. We don't wear masks because of measles. We don't have to do this because we have this general herd immunity where even if there's one person with measles, most other people are protected enough you don't see it spread significantly. So vaccine is going to be a piece of this, and I am feeling very confident that this is not going to be forever and ever, but next year is going to be about a mix of vaccines and masks, and you getting a vaccine when it is recommended for you is going to be, again, protective for you, your family, and then Chicago. A lot of people getting vaccine is going to be what gets us sort of as a city past this and not having to have these mitigation, be able to go economically, be able to get back to sort of, quote, regular life. So without a really solid vaccine, we didn't know how long this was sort of going to go on. You look back at 1918, 1919, multiple years of kind of surging and up and down. A good vaccine helps us really cut that, but it's not going to be instant. It's going to be, over months.
Over time, yeah. Hey, do we know yet if this vaccine is going to be the kind of thing that you have to get every year, like the flu shot, or if it's going to be like measles where you just get it and then you're...
We don't know yet. There's been some preliminary data looking at the immune response that suggests it's likely to be longer lasting. It's premature to say on this. I almost don't even want to speculate. There have been, some experts who say, hey, it looks like maybe it could even last 10 years. It could be like a tetanus kind of thing. One of the questions is how much the COVID virus mutates over time.
Yes.
It's not mutated much at all right now, partly because it has been so successful at spreading, and we've not had a lot of treatments against it. So
working. Why
it's
change?
working. The viruses have been very successful. It's not had a lot of evolutionary pressure to change. The reason you have to get a flu vaccine every year is there are so many different strains of flu, and it mutates a lot every year. So we have to make a new one because there's a lot of different strains. COVID has not looked like that so far. It's another piece of good news. So I am feeling optimistic that this will be something that has some longer lasting immunity, but we just don't know. Even if it was a vaccine that you ended up having to get annually like the flu shot, that would still be a huge win and would let us get past this. But preliminarily, we're feeling good, but it's way too soon to know, right? We haven't even had COVID for a year on this planet.
Right.
So there's been no ability.
Which is hard to believe.
It's hard to believe.
It feels like it's been.
It's hard to believe. But, you know, these studies will continue, right? They don't end when the virus gets approved. We continue to follow. People will be followed long term. There will be lots of studies to understand how long this protection is. But the preliminary information, even there, is looking tentatively is pretty good.
Okay. Well, that was a good segue to Nikki Rose's question. Also, with the different strains of COVID, are they distributed all over the state, country, or is it regionally based for the most part? Meaning, if someone in another state already had COVID, could we introduce them to a different strain that they don't have antibodies for?
That is a good lead-in. So for people who have been following along closely, we do know that it is possible for people to get reinfected with COVID. We have seen that happen, and we have seen that happen. Not really, the word strain has a very particular sort of meaning in medicine, and it means it's actually sort of behaving differently. And we don't really have full-on different strains here, but we have seen mutations, and those mutations are how we know that that person has had a different infection. At this point, very high level, we've not seen major different spreads of COVID vaccine, a lot of mutation, certainly nothing that has suggested that you would need to build a vaccine, for example, that would be different against different strains. Like at this point, sort of the way, because the way actually this is good, the way the virus, the way the vaccines, most of the vaccines have been designed, they're designed against the little spike of the COVID virus itself. Remember this, the coronavirus, corona means crown. It's the way the vaccine is working is it's going after the crown spikes. And so those crown spikes are not mutating. So even if there are some small differences and other things, it's a very clever way to make a vaccine. And it potentially is sort of longer acting, and we could talk maybe more about some of the science of that another day. But there's not sort of, I mean, I got back to vaccine there, but I guess her original question was like, if I go to Indiana, would I get a different strain? We don't think so. Broadly, the genetics of this, and there are lots of scientists watching this, don't think that we're seeing sort of high levels at this point of reinfection, although we know it's possible. A good reason to get a vaccine going again, though, is to sort of cut this and not have as much opportunity for potential significant emergence of different strains. So yeah, it's not that I worry that, you know, this part of Chicago or this part of Chicago has a very genetically different COVID vaccine, or even this state versus this state by and large. But less travel is not so much about mixing, quote, strains of vaccine as it is just giving many more opportunities for close interaction of living, breathing human beings.
Got it. Okay. I think we have time for just one more question. And this one might be, we don't know yet. Adeline Lara from Facebook, what are the side effects of the vaccine?
So we don't know yet. Again, this will be coming out and is being looked at right now by broadly the FDA and the Independent Scientific Advisory Review Panel. However, what has been shared sort of at a high level, at least, out of these vaccine trials is that where there have been effects, they've been minor. Like apparently some fatigue after the second dose, maybe a little bit of a sore arm. Remember, a vaccine has to clear an extremely high safety bar here. When we're developing drugs, we tolerate a little bit more in the side effect profile because we are giving drugs to people who are already sick. And so if you do a little bit of balance
here.
here.
Plus the long list of side effects in
Plus
the commercials.
the long list of side effects with drugs, because you're treating somebody who is already sick, and you kind of say it's worth it to treat the disease and take a little bit of a side effect. Vaccines have to clear a very high safety bar because by definition, we are giving them to people who are well to help them stay well. And so vaccines that are approved, including all of our childhood vaccines, the flu vaccine, etc., they all have to have a safety profile that is really, really good. Meaning, like, a vaccine may give you, I give flu shots, right? A flu shot, it may give you a sore arm. In fact, a lot of people, especially if you go a few years without getting a flu shot in between, you might have a sore arm. There are some people after a flu shot who get you might have a little bit of a fever, a little bit of an achy feeling. You might not feel great for a day or two. That is not the flu. That is your immune system kicking in and sort of building up so it's protecting you against the flu. Side effects like a sore arm or a little bit of an achy feeling or some fatigue, those are the kinds of side effects we would tolerate with a vaccine. We would not tolerate any significant, if in these trials you saw significant side effects that suggested if you gave this to a lot of healthy people, you might actually make them sick, that is not a vaccine that would be approved. So we don't yet know. Trust me, when this is shared, we will be in great detail saying, this percentage of people reported this percentage of people reported this. But the trial is as much about safety as it is efficacy. And the reason everybody's blinded is you follow everybody, whether they got the real vaccine or the dummy vaccine. What percentage of people had a headache? What percentage of people had fatigue? What percentage of people had any problem, whether or not it was related to the vaccine? You stop the trial and you look and you see, was this potentially related to vaccine?
And we had some trials that were paused.
Yes, trials are regularly paused. It is part of the process because the last thing anybody wants, most of all the vaccine manufacturer, is a vaccine that is not safe. We'll take a vaccine that 90% plus efficacy is wonderful. The FDA had said they would approve a vaccine that was even 50% effective as long as it's safe.
Yeah.
So,
all right. Okay, well, I don't know if you had any good news that you wanted to share here with our final.
We do. So there's a few things I've got here, and a few of them are just some reminders that while you are staying home, you can continue to support local restaurants via takeout. And we do have this hashtag Takeout Chicago challenge going right now. If any of you are still feeling like you need to wipe down and be crazy about that, you don't. You can get your takeout, prepare your food, just make sure you wash your hands. But we are asking people who can afford it to think about supporting restaurants at this time. If you get takeout from 10 restaurants or bars before December 15th, you enter in that information into chicago.gov/takeout, and there's a lot of really cool, like once-in-a-lifetime behind-the-scenes tours of Soldier Field and museums.
Taking advantage of all the places that are closed.
Taking advantage of the places that are cold. They're not for now, but they're for later.
Yeah.
But please, if you are able to financially support small businesses, it's a really good time to do that. It's also an excuse to order in some good food. And then along those lines a little bit, there's a campaign which I really like here in Chicago that is thinking about Black Friday, which is the day after Thanksgiving, right? It's the day where traditionally retailers would move from the red into the black, meaning become profitable. And so there's been this take here on really thinking about hashtag Black Shop Friday and thinking about Black Friday to support Black-owned businesses in Chicago. And there's more than 500 in the city. You can find information on blackshopfriday.com. Again, this is a lot about ordering things online and supporting or trying to sort of have that COVID risk in there. But I thought this was like a really cool take on Black Friday.
Yeah. We're trying to support our restaurants, supporting our small business owners.
Exactly. And now is a time for supporting small businesses. So I think those are my main good news. Just the last announcement is that this Saturday at 12 o'clock from 12 to 1, the mayor's office is hosting a community town hall. There will be folks on from CDPH, from the Office of Race Equity, talking about data, questions, COVID, things that impact Chicago residents. So it'll be on the mayor's Facebook page. You can put questions in advance at community engagement@cityofchicago.org. So More opportunity on Saturday if you haven't gotten enough COVID conversation.
Lots more time for Q&A.
Yes.
I wanted to add, we've also been very concerned about those who work in restaurants,
Yes.
knowing that these are challenging times. And so if you are someone who works in a restaurant or in the hospitality field and have been affected by the stay-at-home advisories and some of the restrictions, and you're looking for work, you can go to you can Google Chi Serves, CHISERVES, and there's from the Chicago Cook Workforce Partnership just some access to employment opportunities. You can also text that to 474747, and you will be set up with text alerts about ways that you can get plugged into employment opportunities here in the Chicago area.
Perfect. And chi.gov/Protect Chicago is where you can sign up to help with our ground game for COVID. There are opportunities to help from home. We're doing some texting, we're doing some calling. Sign up there and you'll get plugged in if you want to be part of the COVID response here in Chicago, even without leaving home.
That's right. So in the meantime, think twice.
And be safe, Chicago. We'll see you next Tuesday.